Infection with the SARS-CoV-2 virus, the virus that causes COVID-19, results in ECG changes that, utilizing artificial intelligence and applying it to the electrocardiogram, allows a rapid screening test with a high negative predictive value of up to 99.2%. My name is Paul Friedman, Chair of the Department of Cardiovascular Medicine and senior author on our manuscript.
My name is Tzachi Attia, and I'm the co-first author of this paper. I'm a co-director of AI in cardiology and an AI scientist.
Our manuscript, Rapid Exclusion of COVID Infection with the Artificial Intelligence ECG. It's online now at the Mayo Clinic Proceedings and will be in the August edition.
In this work, we collected data from 28 different sites in 14 different countries from 4 different continents, all recording ECGs from patients with COVID and without COVID as detected by PCR. Using the 26,000 ECGs collected from these sites, we were able to create a neural network that can look at an ECG and, without any supervision specifically to what ECG features we should look at, just by looking at the raw ECG, it was able to detect what would the PCR test say. Is it a COVID positive patient or a negative patient? The ability of the network to detect COVID-19 with an AUC of 0.76 and a negative predictive value of above 99%. The conclusion of our work was that infection with SARS-CoV-2 results in ECG changes that permit AI-enhanced ECG to be utilized as a rapid screening test with a very high negative predictive value. This might permit the development of ECG-based tools to rapidly screen individuals for pandemic control.
This study is important for several reasons. First, it shows how the global community can come together in the midst of a busy pandemic when clinicians, administrators, nurses, hospitals are swamped, and share data in a de-identified manner to try to help the human condition. From a scientific perspective, it confirms a biological connection between COVID and ECG changes, so that when the SARS-CoV-2 virus spike protein binds to the ACE2 receptor, ECG changes occur. That's been known in animal studies, and now we're demonstrating that phenomenon in patients. This may help us in the future in terms of identifying people who are infected or the severity of illness.
In the past, we developed multiple neural networks to predict diseases from an ECG. In this case, we collaborated with multiple sites that had great ability to collect data and stratify it. And we used our AI team to create a neural network. The neural network was looking at the raw ECG, and by feeding it ECGs with the true answer for a certain number of ECGs, we were able to teach the network what is a positive ECG look like and how is a negative ECG look like. Once we developed that network, we tested it on a subgroup of patients that the network has never seen before to make sure the network globalizes well. To create this network, the biggest aspect is the data. We have to have a very clean and organized data set. We created a framework where we collected data from the multiple sites using a red cap survey. We combined the data with the correct labels, with the date of the PCR, the date of ECG, to make sure that we can see the differences between patients before and after COVID. The training of the neural network was done in parts. We first showed the neural network ECGs and the relabel, and after seeing enough of those, the network was able to detect specific patterns in the ECG that predict or detect COVID from an ECG alone. We were able to do so because of the framework that we've created as part of the larger Mayo platform that allows us to get data from other sites and combine with the medical abilities and technical abilities to create a tool that might benefit patients all around the world.
There are a number of next steps based on this research. This was a retrospective large study that showed a biological process and correlation between ECG changes and COVID infection, where the degree of detection, that is the network output, increased as disease severity increased. We want to know whether we can detect asymptomatic patients, with the goal being that if you're going to enter a hospital or airplane or some other environment, you could put your hands on an ECG with a mobile form factor and be cleared. To that end, there's an ongoing study that will be completing enrollment of roughly 2,000 patients soon to address that question. We don't know whether in patients who are not yet symptomatic, we see these ECG changes because so many of the patients enrolled in this study were hospitalized. The second question is, can we predict disease severity? We've all seen the reports about COVID infecting the heart, and the concerns about myocarditis have made the news. Well, one possibility is that this may be an early detector in people who we know have COVID, and to assess whether there's cardiac involvement and potentially more severe disease involvement. Perhaps we can determine who's more likely to benefit from advanced therapies, who needs to be monitored more closely. So in conclusion, this large retrospective study demonstrates the biological relationship between the ECG and COVID that can be detected using a neural network, and opens the door for what we hope will be clinically useful tools in the near future.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.